So this is an advocacy alert for U.S.-based families. Hope for HIE is a global community of over 10,000 families. About 60% are from the U.S. So currently in the U.S., there are certain things that are up on the chopping block that have the potential to significantly hurt families like ours with disabilities and differences. And so those are related to Section 504, to Medicaid funding, and to the U.S. Department of Education and the services and protections to disability rights that it provides. So I want to share that the Disability Rights Education and Defense Fund does a lot of great work for all of this. So if you want the latest advocacy alerts and updates for all of these things that we're going to talk about, you can go there. That's a good source. There's many sources out there, but they do really good work with disability rights. So this is on their website, and it gives the overview of the 17 states that are going after Section 504. And it also gives the history about 504. 504 is not just an educational law giving rights for kids with disabilities and education. It also follows them in college and in careers and allows people with disabilities to be free from discrimination, have reasonable accommodations for their differences in disabilities in the workplace as well. So the fact that they're trying to make this unconstitutional is obviously very concerning for the legions of people with disabilities that fought really hard to get this passed in the 70s. Next is Medicaid. On Tuesday, there's going to be a vote in Congress to look at having the budget for Medicaid. Medicaid is something that a lot of our families use and have, and they might not even realize it. Medicaid can provide funding for early intervention for a lot of people that are on waiver programs. That's through Medicaid. Medicaid supplemental programs that are required by law in all 50 states to be accessible for families of children with disabilities. It's up. Just traditional Medicaid in general for low income and low resource settings and people and families who are taking care of kids with disabilities or kids at the margins. That's up as well. A lot of programs, agency programs, respite programs, home nursing programs are all ran through Medicaid. And so this could fundamentally destroy the funding for all of those things that our families need. So big one here. Lastly, the Department of Education. There's people that want to look at abolishing it. The U.S. Department of Education provides key services and programs and oversight, holding local school districts accountable when their local and state agencies do not protect these students. When things go to the Office of Civil Rights for complaints under the Special Education Office within the Department of Education, that is your ultimate accountable agency for that. Currently, since this new administration has come in, many lodged complaints have been canceled that have anything to do with DEIA, A being accessibility. And so a lot of kids with disabilities who had active complaints in the system have now been canceled out. The National Down Syndrome Congress has put together this really helpful comprehensive fact sheet. It's 3 pages long. It's available on their website. You can see at the top. And it goes over, why the Department of Education is essential for students with disabilities for those of you that may not know. So what can you do as a citizen of the U.S.? You can use apps like this, 5 Calls, that makes it very easy to have the scripting and the availability of resources to help you effectively advocate to your elected officials. This is an example. You can sign up what issues are close to your heart: disability rights, educational rights, healthcare. And so it can auto-populate like this one, looking at defending Section 504, protecting the Department of Education, and protecting Medicaid funding would be 3. Each of these have an opportunity that you would tap on and would give you a script and how to advocate to your representatives. We are all in this together. The 2 effective arms of advocacy are individuals that go to their elected officials, town halls, calling, emailing, all of these mechanisms like the 5 Calls, and then us as an advocacy organization for the past several years have been a part of several coalitions that do regular advocacy, legislative advocacy in the U.S. and beyond, in the neonatal space, pediatric neurology space, neurodevelopmental disability space, disability and educational advocacy rights, all of that, maternal and infant health. There's so many coalitions that are out there, and we have been a member of many and continue to move those forward and engage in the collective advocacy, which can be very, very beneficial. Example, we're a part of the Epilepsies Action Network, which is one of the key partners that's putting together the National Plan for the Epilepsies in the U.S. We're a part of a lot of telehealth collaborations that are really advocating to keep telehealth and expand telehealth opportunities for improved access to care, which I think many of our families have really experienced and appreciated over the past few years. So that's what part of our resourcing goes to, is to be a part of these effective advocacy collectives and coalitions to move forward important things that matter to our community in healthcare, in education, in disability rights, in research, all of that. So that's a big part of our advocacy bucket. We'll keep you updated with anything that we hear of how these things turn out, but really encourage you to use that 5Calls app or another mechanism and make sure that your voice is heard to protect these things for your family and our community.